what if there was something out there right in front of us that we actually could take that actually cures depression? Especially because recent clinical trials have been consistently showing that 1 or 2 doses of psilocybin quickly relieved depressive symptoms, and the effects lasted anywhere from 4 weeks to a year. Richard was my 57-year-old patient in the ICU. He was on a ventilator, unable to breathe on his own. I knew he was in a deep coma, but at the moment I wasn't sure if he was brain dead. That would require some more testing. All of this was a result of intentionally overdosing on insulin to the point of causing his blood sugar level to drop to single digits. In other words, extremely dangerous hypoglycemia. But why did he do it? He left a note on the dresser next to his bed, which in essence said he had given up. Unfortunately, the extreme hypoglycemia destroyed his neurons, and we officially declared him brain dead, and brain death equals death. When his wife was at the bedside, she tells me that he stopped going to therapy and stopped taking his antidepressant medications because they didn't help him, and he was tired of the side effects making him feel like crap. As she was bawling, she asked, "Is there anything else I could have done differently to prevent this?" Of course, that was extremely difficult to answer. But it makes me wonder, could he have tried something else that might have paved the way to overcome his depression? And one of the biggest questions with depression right now in 2023 is the use of magic mushrooms, specifically psilocybin. Does it cure depression? Obviously, a difficult question to answer. Depression is the most common psychiatric disorder in the world. There's been over 30 drugs approved by the FDA to treat adults with major depressive disorder. Generally speaking, these drugs work only slightly better when compared to placebo. Of the 9 million people in the United States taking medication to treat depression, a 2021 study estimated that just under a third of them aren't helped by the drugs, what is known as treatment-resistant depression. And to make matters worse, every one of them come with a number of side effects, typically things like nausea, diarrhea, dizziness, trouble sleeping, restlessness, upset stomach, weight gain, dry mouth, decreased libido, erectile dysfunction, just to name a few. So yeah, it's fair to ask, is it even worth taking them? But what if there was something out there right in front of us that we actually could take that actually cures depression? Especially because recent clinical trials have been consistently showing that 1 or 2 doses of psilocybin quickly relieved depressive symptoms, and the effects lasted anywhere from 4 weeks to a year. Now, in a study done at Johns Hopkins in 2020, researchers showed that when psilocybin was combined with supportive psychotherapy, it relieved major depressive disorder symptoms for up to a month. In a follow-up study of those participants, they learned that those effects can last up to a year.